Thank you, Chairperson. At the outset, I'm really thankful to the organizers, my colleague and friend, Dr. B.K. Mishra, Dr. Akhil, to include me in this. You can say my topic is an odd topic between the oncologist, but it's important because, every day you all must be reading and hearing in newspaper, social media that people are dying during exercise, young people are dying. So the question came to us, and this was discussed a lot, that how much the exercise is good for the heart. And I have got few important, tips for my oncologist colleagues. So as we all understand that, cardiovascular fitness is important, and the ability of heart, lungs, and blood vessels to function efficiently when a person exercises the body. And these are all, important good effects of exercise training. You all know, and you all understand since your physiology days of first year MBBS that clinical effects of exercise causes increase in oxygen consumption, cardiac stroke volume, and maximal exercise cardiac output increases, and so on. So why is cardiovascular fitness is important? It is important for you all as a medical specialist, as a healthcare professional, as well as for all our patients too, because it will increase our energy level. You all feel and look good about your body fitness. You lose the fat, which is an important part of today's epidemic. That's obesity is a big epidemic, which is growing faster than the cancer itself. Helps with stress reduction, improves health, and extend your lifespan. So the most important point which we have gathered recently, that there are two most preventable causes of death. They are, and definitely they are not cancers. They are smoking and inactivity. So sitting idle or sitting, it's also a very important risk factor. And you all can see that global deaths for smoking were obtained from WHO, and it shows that inactivity or sitting itself is also responsible for a increase in mortality. And these are the unadjusted all cause and CVD causes of mortality rates as per the 1000 person years according to TV viewing time. And we all understand that TV viewing is a sedentary uh, activity, and there is a level of prevalence of physical activity among men, women globally. And we all understand that around 60% of the adult population is physically inactive, including medical professionals and healthcare professionals who are really very aware about the physical activity benefits. But even though it's a habit which makes us inactive. So physical activity and survival, we all understand with all these data that having a high physical activity keeps you a better survival over the time. And if you look into the benefits of regular exercise in cardiac patients as well, I'm not discussing for my oncological colleagues that they well understood the importance of physical exercise and fitness for their oncological patient as such. But if you see in this data, there's a progression, and progression, regression, all gets affected by a regular exercise training for cardiac patients. Then comes the question that what is the dose dependent effect of daily exercise? How much should we exercise? Is walking is good or running is good? Definitely running is a better exercise, but if you need to see that how much calories you are using every day, running 3 to 4 times is more effective than walking, but it depends upon what is the level of running which you are doing. And these are the recent articles which were seen in different journals that cardiac arrest occurs during a long distance running races. And so the question comes that whether the running marathons or running a long distances are good for heart, or exercise is good for you. Definitely it's good for everyone. But is exercise a god for you? Definitely not. Because many of us will think that doing exercise is good for heart. But we need to understand that what is the level of exercise which we all should do, and can strenuous exercise harm the heart as well? Yes, regular exercise is recommended to improve the cardiovascular risk profile, but the dose of exercise is important, and that might be if you have too much of exercise, like there is a Parcellus concept of dose related toxic effect, that something goes more than a particular point, then it becomes detrimental as well. So vigorous exertion transiently increase the risk of acute cardiac events. So it is very, very important that we should know, and you should have a training of exercise capacity. So whether the question is, can strenuous exercise harm the heart? Yeah, definitely. If you look into this graph, there's a level of exercise. Initially, the exercise is definitely good for everyone, but as the most of the benefit of the exercise crosses, and then like, if the patient does an extreme exercise and too strenuous an exercises. So, how much is the minimum of exercise for good health? Definitely 30 minutes of moderate intensity exercise. And what is that moderate intensity exercise? That is equivalent to 1000 kilocalorie per week, along with twice a week of strength training. This gives an important reduction in heart related diseases. And whenever you are different societies have given these recommendation that moderate activities of exercises, that is activities comparable to walking briskly of about 3 to 5 miles per hour, may include different variety of works like recreational activities, yard work, household work, cycling, swimming. But 30 minutes of moderate activity daily exercise equals to around 600 to 1200 calories of energy expenditure. And this is really benefit for all those exercise related benefits of increased exercise tolerance, decreasing of body weight, blood pressure reduction, lipid benefits. But does the running is more than just a physical exercise? WHO defines the health as not only physical health, because the physical health is definitely physical, mental, spiritual, and social well-being, and not merely the absence of disease or infirmity. So what we mean to say that doing a few exercise and having only physical health is not going to give you a good concept of health. And the different we all understand that there are two different types of exercises: aerobic exercises and anaerobic exercises. Aerobic exercises lead to a significant reduction in mental health issues. So definitely these are going to help us 30 to 60 minutes per day for 4 to 5 days per week, and exercise more than 3 hours per day. But if somebody does too much of vigorous exercise, they are running for 2 hours, 3 hours per day, they're more than 23 times per month are associated with worse mental outcomes. So definitely too much of exercise is not good. Whenever somebody wants to get engaged in a physical activity or exercise at a middle age or delayed youth, we need to identify who are the people are at risk. The people those who are having family history of sudden death and cardiovascular disease, the relatives diagnosed with above conditions of heart disease, people those are having symptoms of shortness of breath, chest pain, and limitation of exercise, unexpected disease spells, blackouts, and prolonged palpitation. These patients, these persons, though they are healthy enough also, but they needs to be investigated before going for any exercise. And we need to screen them by doing few physical examination is the most important thing. Then comes the ECG and further other examination. And we should alert for people going for exercise program, those who are having exertional chest pain. You all must be hearing day in and out that some young person has died during an exercise in the treadmill, in the gym. They're the people, those who are not working out on these problems, like they're not evaluating their causes of any chest discomfort. Many of them, they have a vasovagal or different types of syncope. There are few people, those who have got occult atherosclerotic cardiovascular disease. And what is this hidden occult atherosclerotic cardiovascular disease? Because many of us of age of 40s, 50s, they have got a subclinical atherosclerosis. And if you scan them by doing the coronary artery calcium score, you can detect them, the asymptomatic patient with atherosclerosis. And the plaque regression occurs within 2 years of aggressive lipid lowering. So all these patients, those who are having subclinical atherosclerosis, they needs to be treated. And the recommendations for lipid lowerings are different for Indian subcontinent. And Lipid Association of India gives a different guidelines what is recommended for Europeans and Western population. BP control, tobacco avoidance, and all those things are really important before going for an exercise program. Though this is a busy slide, but this can give you an important point when somebody wants to get engaged in the physical exercise program who is not really very active. We should need to take the history and physical examination for patients. Suppose somebody has got an abnormal ECG, we need to have at least the evaluation for their ECG changes. If it is abnormal, these patients, they may require an echocardiogram for looking for Holter and other investigation. If the physiological changes are consistent with the level of training, they can be assured to go for a physical training program. But if the ECG and echo that shows some amount of hypertrophy, abnormal left ventricular ejection fractions, or the people in their family, they are having some coronary abnormalities, they needs to be screened further. And the people, those who are having different types of abnormalities like hypertrophic cardiomyopathy and all, they need to go for cardiac MRI or CT angio before taking them for exercise. We need to assess the patient resting heart rate before they're going for exercise, and we all understand how the heart rates are taken for them. We need to see for the recovery heart rate, because recovery heart rate is also very important, and 120 beats per minute within 5 to 6 minutes of exercise is an important aspect. And if the patient's or the person heartbeat doesn't go less than 100 beats after 10 minutes, it means the patient's exercise capacity is poor. And we have got an important formula that is called a FIT formula: frequency, intensity, time, and type. These are the important for our exercise program. Frequency is the number of times per week that you need to perform at least 30 minutes of exercise in most days of the week, or at least 5 days in a week. The American College of Sports Medicine also recommends that it improves the physical capacity. And if you do 3 days of vigorous exercise, it can be also a great serve. And these are the list of those vigorous exercises which can be taken up by any of us. What is the intensity for when we are doing an exercise? At least we should achieve the 60 to 90% of our target heart rate zone. And these can be around 130 to 180 beats for all younger people. Intensity heart rate exercise can be calculated with the formula of maximum exercise minus the resting heart rate, that is multiplied by desired exercise capacity. Like somebody had got exercise maximum rate of 150, resting heart rate is 70, that's around 80, and we want to do 0.60, 0.60, or 60% of the desired intensity. That can be calculated by having this around heart rate of 115 to 20. Maximum heart rate, how you can calculate for any age: 220 minus age. Like my age is 50 years, so 220 minus 50 will be 170 will be maximum predicted heart rate for my age. Time, how much you should devote, it's your exercise duration is how long you can exercise. At least 30 minutes of exercise in most of the days are important for all of us. Aerobic versus anaerobic, we all understand that anaerobic exercises are short bursts of exercises. There are few examples we all understand, like playing volleyball, weightlifting, and all. Aerobic exercises are preferred over anaerobic exercises. We need to train ourselves, and we should have a short warm-up period before going for exercise, and always a cool down period after the warming up period. We need to hydrate ourselves quite a lot. And dose of jogging and long-term mortalities says that if you do too much of strenuous jogging, like too much of strenuous jogging also causes high mortality. So if you look into this diagram, the higher the rate of exercise, like more than 14 minutes per day, can lead to right ventricular dysfunction, myocardial fibrosis, and attrition. So as you increases too much of exercise, the fitness levels, though it sometimes get better, but it will going to harm you as well. So the dose limit exercise, like any other pills, is more than be too toxic. 15 minutes per day of the benefits continues to 1 hour per day, but no health benefit if you have running more than 25 kilometers or more than 1 hour per day. And there are many more side effects, like of high intensity aerobic exercises, like your patient are prone for atrial arrhythmias. So how much is too much for all of us? More than around 150 minutes of moderate physical activity plus muscle training exercise for 2 or more days per week, 75 minutes of vigorous intensity aerobic exercise and strength training for 2 or more. Additional health benefit can be obtained by increasing the modest intensity physical activity. So the carry-home message for all of us is that pick up the choice of your aerobic exercise, like dance, walking, running, sports, cycling. Do regularly, lifelong, over the next 20 to 40 years, 5 to 6 days per week. Muscle strengthening exercise 2 or more days is also important. Avoid tobacco and alcohol. Avoid anger, jealousy, greed. These all comes with practice. Like we all get trained over time. Enjoy healthy meals, good sleep, pranayam, and stable moods. And these are some small tips, my oncologist friend. You all are dealing with the most dreaded disease of mankind, which I personally feel so. And patients come to you with fear and negative emotions. And the practice to be positive and infuse positivity, because I always see that too many negative emotions are coming with all those patients. Medical fraternity is in great stress. We all know that. To remain cool and accept the circumstances in life as it comes. We are not supermans. We all understand that. Accept our limitations, and acceptance is the most important thing. Empathy, I always feel, is also a great medicine. I have learned so many trials, so many markers, but many times we forget about this great medicine of empathy. Put your feet in others' shoes and feel the pain of those patients. You and your family are equally important, and create a balance between profession, family, and yourself. Thank you all for your patience.
Excellent talk, sir, and actually thoughtful and insight. You gave excellent insight of this important aspect, which we all of us are neglecting, and we should follow the fit formula which sir gave. It's a wonderful formula. Probably I'll start doing it from next day morning. Thank you so much. If there is any question or any query, we can. Yes, sir, please.
According to my newspaper reading, post-COVID, there are more sudden cardiac deaths compared to pre-COVID. Maybe it's just a notional thought process, but has COVID got anything to do with the sudden cardiac death?
Right. You have asked a very valid question, and this question is already in many healthcare professionals. Definitely, post COVID, the one pathophysiology which has started is a basically it was a COVID was causing too much of endothelial dysfunction, and a lot of inflammatory responses have triggered up. We all have seen that there is a increase in the incidence of new onset of diabetes post COVID, and similarly, as we all understand that atherosclerosis is an inflammatory process. So people, they have, as the incidence of new onset diabetes has increased, the incidence of new onset, or faster the atherosclerosis has caused that. And we all understood that, COVID has caused too much of emotional, financial, loss of many of our closed ones. Many of us have got a great financial loss, professional loss, and all those things. These all stress has definitely increases the incidence of acute events in the recent years. But that's not the case that these incidents were not actually occurring previously also. There are some role of media hype as well. So we all have to understand that, there's a balance between everything. But we all understood this fact that, we are much more careful about our health post-COVID. We are not paying so much of attention for our health because, we're thinking that health is a God-gifted thing. We all understood that exercise is a good habit to inculcate in ourselves, but we also have to understood that how much is the dose, because many of us, they go for an exercise program as middle of the age, go for a treadmill running without knowing their previous risk factor, without knowing their previous lipid levels, without knowing their risk profiles. So I always advise my younger colleagues, and those who are even 25 years plus also, that they need to understand, like, there are definite markers for cancer detection. We all have got a very small important markers. There are, know your figures, know your numbers. Or what are the numbers? Your height, weight, BMI, that gives you one important number, your blood pressure, your lipid levels, and your stress level. So if we have got all these 4 or 5 important factors to be assessed, and those who are at high risk, family history of heart disease, having diabetes, hypertension, or dyslipidemia, all those things, they need to be assessed before going for any strenuous training program for exercise. We should not think that, yeah, I'm healthy enough to start for running for treadmill from tomorrow and go to